There's two main entrances in the hospital. There's the main entrance to the whole hospital, which comes off the car park. That entrance is only open during the daytime and it does close at 9 o'clock at night. The entrance to A&E is open 24 hours a day, so that's where we recommend that you come in. There is a drop-off zone outside of A&E, so your partner can drop you off, leave the car there for a maximum of 20 minutes. So that gives you long enough to make your way up to labour ward, and then we would ask him to go back and move the car because there are very few emergency spaces there. Hi, I'm Karen, one of the senior midwives here at Durham. I'd like to welcome you to our unit. At Durham, infection control is a really important part of our work, so we'd ask you to either wash your hands or use the hand sanitisers as you move around the unit. And please don't be frightened to ask any of your caregivers to do the same thing. We're also very security conscious here, both for our women and our babies on the unit. So we operate a buzzer system at the door. Please press the buzzer and let the ward clerk or the midwives know who it is you want to visit, and they'll let you onto the unit. Please don't let anybody else onto the unit who might follow behind you. We're really proud of our unit here at Durham, and we look forward to welcoming you to have your baby with us. We've recently been voted in the top 5 nationally for patient experiences here, and we hold some fantastic accreditations for our patient safety record. Welcome to one of our normal labour and delivery rooms here at Durham. We've got 15 rooms like this, all of them are en suite. We try to keep them as non-clinical looking as possible, so a bit of a home from home environment. The midwives that are looking after you will try and encourage you to keep your labour as low risk as possible and to keep as mobile as possible throughout your labour. And we've got various pieces of equipment that we can use and to enhance this, things like the birthing balls and the bean bags and birthing chairs. Some women will need a little bit more interference from us and a little bit closer monitoring of their babies. They may need babies' heart rates monitored continuously throughout their labour for a number of reasons. So we have plenty of these machines around. A lot of the machines have mobile transducers on, so you can still keep upright and still use some of the birthing balls and things to try and make your labour as normal as possible. This is Paula, who's one of my colleagues. Paula, you've worked here for a long time, haven't you? Can you tell me a bit about what you feel about working at Durham and the service that we offer our women?
I've always found Durham a very welcoming unit. You know, I've been here many years. I find everybody works as a team. We all help each other out, but always at the centre of the care, the most important thing is the mother and the baby. You know, we always use that, that is our goal, a happy mum and a happy baby.
We're very lucky that we have a special care baby unit situated right at the end of labour ward. We have 24-hour paediatric cover as well, so if we need any extra input in looking after our babies, then they're there as soon as we phone them. In our birthing room, we have mood lighting on the wall, so we can control the lighting and dim it to make it a nice, relaxed, calm environment for the women and their partners when you're coming in labour. We have ensuite rooms, as all the rooms are, and we've got direct access to one of our normal delivery rooms next door. So if you wanted to get out of the pool, or if you needed any resuscitation equipment and beds, we can move directly and quickly into the room next door. We've also got CD players, so you can bring some music in with you to help you relax and make it more a home-from-home environment for everybody. Women that have specific medical issues, maybe high-risk pregnancies for various reasons, may not be suitable to labour and deliver in the pool, but we would still try to use other equipment to keep you as low risk as we can. Our theatre's just used for our obstetric patients, so we don't have any other hospital cases going on in there. So it is available to us 24 hours a day. If you end up being transferred there during your labour in an emergency, the midwife that's caring for you will go with you, and your birthing partner will be able to go with you in most circumstances as well. This is our obstetric theatre here at Durham. We're very lucky here to have a theatre that's a part of the labour ward. So if you needed to come into theatre for any reason, we have really quick and easy access to get into here. We use the theatre for elective work as well, so if you have an elective caesarean, you may come into this theatre to have your baby. And we also use it for any emergency procedures that may occur during your labour for you or your baby. As you notice, when you come into the room, it's a very different environment from the calm, quiet labour room that you might have been in with just 1 or 2 people in with you. Immediately as you come through the door, the temperature's quite a lot cooler in here. We've got lots of bright lights and there's a lot of busy people in here doing things. But everybody's here, they all have a role and they all need to be here to look after you and your baby. As you come into theatre, you'll already have met the anaesthetic team who'll be looking after you during your procedure. They're here to make sure that the mum is healthy and that kept pain-free. As you come through the theatre, we have our obstetric team, usually 1 or 2 or maybe more doctors who will be looking after you during the procedure and making sure that mum and baby are both delivered safely. We'll have various midwives and healthcare assistants who are also here to make sure that any operations run smoothly and to assist the surgeons in their work. And finally, we have any resuscitation equipment we might need for babies once they're delivered. We would have 1 or 2 baby doctors here as well to look after your baby. Normally your baby would be brought straight to the resuscitator just for a quick check over, and if everything's fine then they'll be brought back to you on your tummy as soon as possible whilst they finish off the operation. Any woman that's been to theatre will go straight into the recovery following the procedure in theatre. Again, you would be accompanied by your midwife the whole time and the theatre recovery nurse for the initial 20 minutes of your recovery. You normally stay in there for about an hour or so until we're happy that you're safe to be transferred directly to the postnatal ward. During that time, your partner and the baby would be able to be in recovery with you. We do have quite a strict visiting policy, both on labour ward and on the antenatal and postnatal ward. When you come into us and you are in active labour, you will be allowed up to 2 birthing partners to spend the entire time with you when you're in labour. Once you go onto the postnatal ward, there are visiting policies in place there, and we would ask you to restrict visiting to 2 or 3 people around a bedside at one time. Welcome to our antenatal and postnatal ward. This is Elaine, who's the sister in charge of the ward. Elaine, can you tell me a little bit about your ward?
I can. This is obviously the antenatal and postnatal ward. Women are sometimes admitted here antenatally before they have their baby, but most often they're admitted here after they've had their baby in the postnatal period directly from the labour ward when they're transferred over here by their midwife. We have a variety of rooms on the ward. We have a 2-bedded bay, a 4-bedded bay and single rooms. Most women are nursed in the 4-bedded bays unless there's a medical need when they could be transferred into a side room. They're cared for by a variety of staff from myself, who's the ward manager, the midwives, healthcare assistants and maternity care assistants who will all assist with their care in the postnatal period, teaching them how to care for their baby from feeding, changing nappies and bathing their baby. All this will be done in preparation for them taking the baby home.
Thank you very much for watching our tour of the unit. We hope it was informative for you and we look forward to welcoming you here when you come in to have your baby with us.